Just by the way of introduction, Ajaita Shah, to what you do, you've been working for the last 10 years through your social enterprise Pancha Markets, which reaches the deepest villages in rural India, connecting rural families to solutions by investing in rural women entrepreneurs as Saral Jeevan Sahelis. So there are 10,000 such Sahelis and you're reaching 3 million rural citizens today. The reality of rural India is very different. What are the barriers to self-care in rural India, Ajaita?
Thank you so much for that question, Ambika. I think a lot of what was said earlier still applies to rural Indian women. The challenges are just much harder because rural women don't have outlets. They don't have space to communicate. They're not connected to digital solutions. They're not connected to health infrastructure. They're not being given information that's adequate. They don't have spaces to speak. And fundamentally, they live in 700,000 villages all over the country. So on a fundamental level, what we see is all the barriers that mothers have, these women have as well. The difference is it's poor infrastructure, healthcare, poor education, and unfortunately, poor agency to be able to make confident choices and decisions. So there's a lot of isolation that we end up seeing there in India, which leads to more deaths, more illnesses, and because of the lack of infrastructure and capital, it's harder to treat.
Given this very enormous challenge, what is the opportunity? What can frontier markets and the Sahelis do to put this choice of self-care into women's hands and minds? And how do we address the women's basic needs enough that she can focus on self-care and on herself?
Yeah, great question. So I think that for me, what's been really interesting working with our Sahelis is they are ready for change. So one thing that we know very clearly is when women have access to income and they have access to digital connectivity, they feel very confident that they can take on the world. So our Saral Jeevan Sahelis today have become these health champions. They've become these social influencers. And so what they've been saying to us is they've been saying, Ajaita, give us the opportunity to now tackle self-care. We know if we get access to the right information and we get access to the right solutions, we can bridge the gap for our fellow rural communities.
Yeah.
So what's exciting today, sir, is that
remunerative for them as well?
Yeah, so what's nice about our Sahelis is they connect to the self-help group networks in India. Today, there's about 165 million women that are part of the self-help group networks. They're eager to have action. They're eager to have connected to solutions. Sahelis become the vehicle to make that happen. And so today, Sahelis are sitting here saying, give me the tools, I have my technology, I want the opportunity, let me change rural India and create self-care in a way that can make the world change and create Swasth Bharat.